Hi, this is Satoru from Haikyuu Acupuncture Nerves. I have an excellent technique to share with you today that you can release your chronic knee pain by yourself. If you suffer from knee pain, you know how difficult it can be to perform even the simplest tasks such as getting up from the chair or car, walking upstairs, or even just simply standing. Then your motivation will be affected and negative thinking can set in, leading to weight gain, stress, and anxiety from knee pain cause you to eat more, which put even more pressure on your knee, making the pain worse. This creates a vicious cycle that's hard to break. But don't worry, you can reverse it. The roaring pin techniques that I'm about to share with you break free from the cycle and enjoy a better life without knee pain. You don't need any special equipment, just a roaring pin from the kitchen. You can easily perform these gentle techniques at home while watching TV on the couch. Try it today and see the difference from yourself. Let's discuss a knee inflammation, which can be caused by various causes such as arthritis, tendinitis, bursitis, ligament tears, and more. All of these conditions can cause pain due to inflammation in the affected tissue. But why does the inflammation occur in the first place? It is the body's natural response to injury or infection, acting like a superhero to protect us from the foreign organisms like bacteria or viruses. However, chronic inflammation can lead to various health problems. Inflammation can be caused by three factors. Number one, infection. Infection happens when bacteria enter the body through a cut or wound. The immune system immediately responds to fight off these bacteria. This response can cause symptoms like swelling, pain, and fever. Once the immune system successfully eliminates the bacteria, these symptoms should go away. Antibiotics may be prescribed to treat the infection and speed up the healing process. Number two, injury. This type of injury can result from playing sports or from repetitive strain caused by running. For example, in sports like soccer, a kick to the shin can be extremely painful, and soon after the leg may become inflamed and swollen due to the damaged tissue. The muscle tissue is affected and the white blood cells work to repair the injured area. Typically, anti-inflammatory drugs like NSAIDs are taken to reduce swelling and pain, which can help to promote the healing process. Number three, systemic. Inflammation can be perplexing at times, as its cause may not be easy to determine. It can be triggered by the certain foods or medications. Additionally, our own body tissue can also cause issues, which can lead to conditions such as rheumatoid arthritis. Although antibiotics or NSAIDs can provide some relief, they may not always be effective in treating this type of inflammation. And it's vital to understand that inflammation can also arise in your muscles and fascia, the thin connective tissue surrounding your muscle. Particularly in the case of your knee, this inflammation can cause muscle tightness and the tendon and bone to pull, leading to the pain in the surrounding tissue and joints, called myofascial pain syndrome. Surprisingly, MRI, X-ray, or CT scan cannot detect this muscle tightness, which is why a doctor may misdiagnose it as tendinitis or arthritis without knowing the underlying cause. And this type of knee pain is a very common problem, with some experts estimating that up to 85% of the general population develops it. As someone who has worked with numerous knee patients, I can confidently say that many of them experience myofascial inflammation and muscle tightness that leads to knee pain. The muscles involved in the knee anatomy during this roaring pin exercise are primarily located inside the knee and attached to your tibia bone. The main muscles are semitendinosus, gracilis, and sartorius, and their attachment point is called pesansalin, which resembles a bird footprint. Semitendinosus is one of the hamstring muscles located at the back of your thigh. Gracilis is the longest muscle inside the thigh and round from the pelvis bone. And sartorius muscle is the longest muscle in the human body and connected the hip bone to the pesantilin. The rolling pin technique is similar to the massage stick or roller stick technique. It helps by improving blood flow, reducing swelling and inflammation, and releasing muscle tension around the knee. And let's go to the kitchen and grab a rolling pin. If you don't have one, you can ask someone to borrow it. This exercise is designed to help with the inside of your knee pain and can be beneficial for conditions such as pesantilin bursitis, arthritis, MCL injury, plica syndrome, and medial meniscus injury. To perform this exercise, start by sitting on the couch or table and bend your knee at the 90-degree angle. Place a rolling pin just above your knee and apply pressure. Make sure not to push too hard, but enough to feel the rolling pin. Roll the rolling pin upward towards your hip, and you may feel sore or tender during the exercise, but that is normal. Repeat this motion 30 times, making sure to only roll upward from your knee to your hip. Okay, number 2. Please scoot back on the couch or bed or table and place your feet up. Make sure you bend your knee at the 90-degree angle. Place your ankle at the edge of your table. Now place your roll pin just above your inner knee and apply pressure while stroking towards your groin. Repeat this stroke 30 times, always making sure to go upward from the knee to groin. Remember to take a deep breath while performing this exercise. Number 3, split your leg over 90 degrees. Place your ankle still at the edge of your table and positioning the rolling pin just above the inner knee. To make it easy, apply the corner of your roller pin and repeat the stroke for 30 times, always moving upward from knee to groin. Do these techniques into your routine can make it in your progress. So after the rolling pin exercise, it's recommended to apply a heat pack to your knee or groin for at least 20 minutes. You may be wondering why not use ice instead of heat. While ice can reduce the swelling and relieve pain, especially after acute injury like a post-surgery or injury within 24 to 48 hours. It can also hinder blood circulation and to slow down the activity of white blood cells, which is counterproductive to the healing process, especially if you have a chronic knee inflammation. On the other hand, applying heat can speed up the body's natural healing process, which is why it's recommended. I really hope you enjoyed this video, and if you or someone you know is struggling with the chronic knee pain and wants to find a way to relieve it without injections or surgery, try this exercise every day and see the difference for yourself. Thank you for watching and see you in the next video. Take care.